Based on the population level data, we thought it will be very interesting to test a hypothesis about overall survival outcomes in African-American men and Caucasian men. And our initial hypothesis was that African-American men will have worse survival outcomes than Caucasian men. So in order to test this hypothesis, we pulled data from 9 randomized phase 3 trials, and that comprised of over 8,000 men. So out of these 8,000 men, what was really interesting is that 85% of the men were Caucasian and only 6% of the men were African American. So nevertheless, we went ahead to test our hypothesis, and in an initial analysis that we undertook, we found no differences in African American and Caucasian men. The median overall survival was 21 months. But when we did an adjusted analysis, adjusting for important variables, what we call prognostic factors, that might affect the survival outcome, and some of these variables are like age, prostate specific antigen level, alkaline phosphatase, etc. So when we adjusted for these important prognostic factors, what we found out was that the hazard ratio was 0.81. Favoring African American men. So what does that mean? It means that the risk of death was about 19% lower for African American men than Caucasian men.